Don, thank you so much for being here today. Can you give our viewers an introduction to Lexington Biosciences and the company's business model?
Sure, I'd love to. So I created Lexington with a partner, and it was founded to commercialize a device or a technology that was invented at the Lawrence Berkeley National Lab. Lexington's technology is a cardiovascular disease prediction device. Everybody knows that cardiovascular disease, heart attack and stroke, are the silent killer. 1 in 3 deaths in North America are from heart attack or stroke. Yet most disease work, most of the medical work we know is reactive. You don't go to your doctor until you know you have a problem. Lexington is commercializing this technology, which we're calling the Heart Sentry, which is a predictive device. We are going to try to help the public learn when they have heart disease. The average person has no idea if they have heart disease or not until they have a heart attack or stroke. And that's a really bad time to understand that you've got a disease.
So how does Heart Sentry work exactly? Is it something that, that you wear on your body all the time, or is it something that you can take on and off? And what exactly does it measure?
So the Heart Sentry will show up looking like a blood pressure cuff. So everybody's familiar with a blood pressure cuff. It goes in your arm, it squeezes, and it measures your blood pressure. Heart Sentry does the same kind of thing, except it's measuring endothelial function. Now, this is a technical word, but if you look at your artery and cut it in half, there's a microscopic layer of cells inside your artery called the endothelia. And the endothelia has 2 functions. It acts as a lubricant to facilitate good blood flow, but more importantly for your cardiovascular health, the endothelia is a shield and it protects your artery from plaque. And plaque is present in your bloodstream, and when the endothelia breaks down, plaque will adhere to the arterial wall and start building up over time. That plaque will build up to the point where it restricts blood flow, which leads to a cardiac event. The Heart Sentry can measure the health of your endothelia, and when your endothelia is breaking down, that's what leads to these cardiac events. And it's called the silent killer because people don't know. So the Heart Sentry is a revolutionary technology that can assess this and help people understand if they're having an increased risk of having a cardiac event.
What about on the regulatory front? When are you looking to bring the product to market?
Lexington has only existed for about 2 years. And in 2017, one of the biggest things we did was we worked through our regulatory specialists who were advising us, Nancy Linz, and we worked through a process with the FDA in the United States on the technology's been assessed in a lab environment, and it worked very well there. And the FDA said, if you can replicate the results you had in the lab with a 150 patient study, we will let you start selling this device and make claims about what the device can do. So unlike a drug that will cost hundreds of millions of dollars and take many, many years to get through the regulatory process, the device permitting regime through the FDA, we point to ultrasound and endopat and say there's a device that's already doing this assessment. We can do that same assessment in a different way that does no harm to patients and it's useful. And so the FDA said you'd go and do that same study on 150 people. The turnaround time is supposed to be 90 days. I know there will probably be some back and forth with the FDA on the data, but it's a regulatory, relatively straightforward process that we should be out of that FDA approval process in 2018.
So that's a huge catalyst that investors have to look forward to before the end of the year. What else is on the horizon? What can shareholders expect?
So the main things we're working on this year is getting through our clinical trials, then submitting the data to the FDA to get out of the permitting process. The other things we're working on is the commercialization of the device. So ultrasound and endopat have what's called a reimbursement code. So in the United States, because it's a user pay healthcare system, if the insurance industry covers a procedure, then it helps you sell that procedure, or in our case, the technology. But I think the bigger opportunity here for us is the consumer market. So we are planning and figuring out and mapping out our commercialization strategy. And there's 2 ways we can go. 30 years ago, the only path to market for us would have been licensing this device, licensing this technology to an existing blood pressure cuff manufacturer. But today, with the advent of the internet, you can take a product like Heart Sentry to market as the manufacturer. the distributor and be successful as a company. So we're looking at those two different pathways. And when I look at the existing cuff market at $2.6 billion a year, there's a lot of people out there that want things like HeartSentry to help them understand their health and is everything good or should I be doing something different?
Well, Donald, thanks again for your time. We appreciate it.
You're welcome.